Hi everyone, I'm Rachel A. Cabanban, a student nurse for today. And today I am going to present the 3 nursing intervention for a patient experiencing hemiparesis. Hemiparesis is a partial weakness on one side of the body. It can affect the left or the right side of the body. The weakness may involve the arms, hands, legs, face, or a combination. People who have hemiparesis are still able to move the affected side of the body, but with limited strength. One side of the body may become completely weak. This is condition called hemiplegia. The first intervention that I will do is that performing the upper body dressing with my patient who has a stroke affecting her right body. Before I will assist my patient with dressing, first is introduce myself, explain and inform the procedure. This is to have knowledge of my patient and to gain rapport. Hi ma'am, I'm Rachel A. Cabanban. I will be your student nurse and today I will guide and help you on putting your clothes in an easy way since your right arm is weak. Next is wash my hands. So using an alcohol to avoid transmission of germs. Ensure that the clothes is clean. The preferable clothes size is larger than the usually worn. The first thing to do is putting the shirt in an affected area, which is your right arm. Hold the shirt using your left arm to do. Next is the left arm to insert the shirt. After that, grab the shirt, then tilt the head to enter the hole of the shirt. During this part of skill test, it is important to remember not to pull, push, or otherwise wrongly manipulate your patient. The second intervention is how to position a stroke patient in a safety and comfortable position. It is important to change the positions of patient regularly so that to minimize a risk of skin breakdown, contractures, and chest complication. The position that we will perform is lying on the strong side.
Ensure that the patient is well rolled over onto her side. Place a pillow under the weak arm to support it. Place the pillow under the weaker leg to support it. Positioning needs will depend on how severe the patient's stroke was and which part of her body were affected. In all cases, good positioning helps the patient to prevent more harm to their affected limbs. Good positioning also helps them to prevent future pain and help them to maintain the normal range of motion in their muscles.
The last intervention is how to help a stroke patient to walk using a cane. Stroke may cause paralysis of one part of the body and the patient may find it difficult to walk. The equipment that we will be using is the walking aid, which is the quad stick.
In walking the patient, always stand on the weaker side of the patient. Place the hands around the hips of the patient or you may use a gilt belt. The height should be the level of the wrist of the patient. Move the cane and the weaker leg forward at the same time for the same distance. Thereafter, move the strong leg forward and place the weight on the strong leg.